doing?
I never knew how to do it, but Tony showed me how.
Okay.
So,
all right. What? Oh, yes, ma'am.
Is there any way to not make it be so tight on the thing when you got to change it over to the leg band or something? And then you know how like the rubber piece?
It has to be tight because if it's not tight, it'll come apart every time.
Yes, and the urine will leak out.
It's just to smack you in the face if you don't.
It has to be. Because if it's loose and it expands so much, it will come loose every single time.
Okay. What was your discomfort level with Dwight?
I never was introduced to it, so.
Okay, but you do know how to do catheter care, right?
Now I do.
Oh, all right then. All right.
Tony.
Alrighty then. All right, I think I got enough toys. All right, question for you guys. Go through the steps of what you guys are doing, because I need to know so that I can stop, because I bet you somebody doing something real goofy with this catheter. First of all, the suprapubic catheter is inserted into the person's stomach because they're having problems urinating, eating out of the penis or through the urethra, which is the actual area where the urine comes from. It's like, what are you talking about? Okay, the urethra, how can I explain this to you? In a gentleman, is in the penis area, is probably right behind the, what do I want to say here? Probably the prostate area. It's right behind there. In the woman, you have 3 openings. You have the anus, you have the vaginal area, and you have the urethra where the urine comes out of. All women agree with that? Mm-hmm. They say yes.
Yeah.
So that's a lot more anatomy that you probably won't ever hear unless you go to school, become nurses, and all that good stuff. Where in the case with a person with a suprapubic catheter, they made a special opening that's go right to the person's urethra because there's a problem. Either having chronic bladder infections, they're having problems with emptying their bladder out, and all other chronic problems, or maybe some type of cancer or something that occurred. So there's an opening that goes inside of the stomach where they have put this catheter in there, and it has a little balloon. And some of the things I pulled out, this is like a catheter. This catheter here in this particular patient uses a 22 French 5 cc balloon. I mean, it's 22 inches long. It has a balloon, which right here, where it blows up with a device, with this little bitty catheter, which I'm not sure what you guys, probably not responsible for. I might talk to Crystal. All right, you're going to say you're doing too much. You know, this is probably done every 4 to 6 weeks, got to get changed, because it's anything that you were not born with will cause infections. There's a good site of infection. So this is a little thing down here, balloon is blown up, and it's how the catheter stays and remain in a person's stomach or close to your urethra. Did I make it clear so far? Mm-hmm. Now you may very well walk into the gentleman's room and this thing may be out. Have that happened so far? Has it been here? No. How fresh is this catheter? Suprapubic catheter?
Yes.
I just changed.
A week?
Yeah.
Wow.
No, he's been had it.
I'm gonna say, wait a minute.
No, he's not me like when he got
so is it changed in your past?
Yes.
I say you just a brand new fresh suprapubic catheter. Like, stop it! Right, don't do that. So this is something that has to be changed on a weekly, on a monthly basis. You guys do it? 4 to 6 weeks. Okay. So if you ever walk in this room with this, you need to cover that up immediately with a 4x4 and call someone. Call the doctor, contact Crystal, Karen, because that will need to be changed. Okay, because the area where the catheter is inside of the stomach will close up really quick. It will really quickly. So when you guys are going in cares and you stripping the beds and you're like, be careful. Do not yank this thing out of the man's gut. It will hurt him. Okay, and cause some major damage. So be careful with that. All right. Now, when the area that this is connected should be into a catheter bag. Is that correct?
Mm-hmm.
Okay. Tell me what you guys are doing. I can tell you what you should not be doing. How are you doing this care so far right now? What is your routine when you go into this room? Speak up. I can't hear you.
Check the
changing the catheter bag. This bag right here, the catheter bag. How often are you guys changing the bag?
How often is it supposed to be changed?
Changing the bag, we changed from a leg bag to a night bag.
Is that what you guys doing?
Yeah.
Okay, let me ask you a question. When you change it from the night bag where the urine is full, for those who in here working nights?
Okay. We work second shift.
You do second shift? You working nights? You working nights? Okay, you guys are working nights. How many times you go in the middle of the night changing the urine or emptying the urine in this container?
3 times.
During the night?
Actually, I check it, and if it's not full, then I'll go back on my second rounds,
Okay.
and if it has a lot of output, then I'll empty it.
Okay, are you guys measuring the output?
No.
I
write it on the paper, however many cc's it is, I write it.
Because it's important, because this device is measuring the urine output in his bladder.
Okay.
Okay.
Okay, it is important. You just can't just dump it in. I'm going about my business.
Where do you
my
document that?
I document it on a 2-hour
On the 2-hour toilet.
Okay.
I put how many cc's was in there when I dumped it.
Okay,
So
it looks
actually,
like everybody's not
she-
doing that. You should be, because this is just as important if you were measuring it in like a nun's hat or a nurse's hat, because you need to know how much output, because whatever input he's taking, whether said he had a diet soda, had a glass of water, or 2 or 3 sodas, we want to know how much urine we're getting out. Because if we don't understand how much urine output, so the person may have a bladder infection, he may have a problem with the catheter inside the bladder itself, or it could be a lot of complications. So you should be measuring the amount of urine in and out if you can. But definitely the amount of urine. And what is also important when you look at it in this bag, or either the leg
To
bag.
see if there's blood or anything in his urine.
Okay, what color has the urine been so far?
Yellow.
This one looks bad, it look like it's kinda tinted or something.
Like it's a
The
dark,
bag look like it's kind of tinted.
like it's dark yellow.
Yeah,
The bag look like it's kind of tinted.
like brown looking.
It's
Maybe
like
it need to
2
be
shades.
changed.
This bag right here, or the leg bag?
No, the
The
night
night
bag.
bag. The leg
The
bag
day
is new.
bag.
Okay, let me ask you guys, when the bag was changed, was there a date when the bag was changed, was put on the bag?
I
No,
didn't see
and not
it.
changed.
I didn't see
Who
it.
was responsible for changing the bag?
Then there's a home health nurse that comes in
Yeah,
and does
And they're
that?
not putting a change on the bag when,
Did they do that for you when he was at Fardale, Tony?
No, 'cause I didn't.
So that's
I put
something
the
we should
leg
ask
bag
them
up
to
a
do?
new leg
it
bag.
couldn't hurt.
Okay,
I mean, even though they're responsible for it, but then if something would happen, it's not gonna hurt.
okay.
I mean, it's just for you guys' safety and your responsibility, putting the time or day, so if something would happen or a home agency changed or something, that's not gonna hurt. It just keeps continuity of care for the next
Okay.
person. Do you guys, when you're changing the bags from either the night bag or to the leg bag, what is your procedure when you're changing the bags?
Make sure it's emptied and you're
Wash it
wiping
out.
each one
Wipe it
with
over with
alcohol
alcohol.
swab.
Is that going across the board or that's something new? Speak up, because this is important. You're gonna make sure that this man is not getting any infection. And the only way not to get infections is when you're changing the tubing. Is everybody on the same page on?
I put a box of alcohol wipes in his room last week because there was none in there.
Okay.
And I had let some of the staff know that we should be wiping it with the alcohol wipes, all the spouts, the bag, the tubing, so that it's not getting infected.
Exactly, because you do not want this
I
gentleman to
don't know
have
what
an
happened to the
infection.
box of alcohol wipes. When I came back the next night, the box was gone, so I left it.
And we put
Okay.
another one in there.
It's important because it is important. It is important that you guys do that because you're responsible. It would be the same if you were doing his peri-care, if you were changing his Depends, or if he was still able to go and you're doing his personal cares. It's important. This is just as important because this is a site of infection. If this is not changed properly, it's like, oh, I'm cutting corners, I'm not going to do it. I guarantee you this gentleman will have a urinary tract infection with no problem. This is a device that is not normal and it will sit there and it will collect germs. Should this bag ever be on the floor?
No.
Should the leg bag be on the floor?
No.
Why not?
There's germs on the floors.
Right, and they will crawl in the bag, go around the opening, it's not clean, and it will crawl and go through this bag and go to tubing.
What if it's in the pillowcase?
I was just about to say.
It's on the pillow,
It's in the pillowcase.
that's fine, because you don't, that's for his personal dignity.
Cause I
No
put
one
it in the
should,
pillowcase.
no one should see this.
Yeah.
Should this bag, yes ma'am,
We just got a catheter cover that I think might have arrived today, the bag cover, so we
Okay, that's good.
put that
I
on.
was putting it in the pillowcase.
I used to just put it on the
that's
bag
fine.
and
Let me ask you a question. Should this bag ever be up like this?
No,
Why?
because it
It's all,
needs to
it's
flow
not
down.
flowing back in him.
Right, and it's to back up into his bladder, and then it just, the dirty urine that came and dripped down, it'll go right back into his bladder. Okay? Should this, when you put it on his leg back, should you put it where it's curled up and secured? How, should it be hanging where he can pull it? What would you-
No.
It should
I
be
got a
straight.
flashlight.
I'll put it like
Okay.
I put
that.
it
There.
like when I put it on, I put it in his the pin, I slide it, the bag through there, so when I pull it up, it won't be under his
Okay.
tubing, so it will be over his tubing, so it can
And
flow
then,
down.
and then how many leg straps you using for his
Two.
Okay. And make sure they're proper position because you don't want to cut off his circulation with the things, okay? But it should be secure.
So where's the leg bag supposed to be? Because I know when I get them dressed, I put it like right here or
On the inside.
on the inside.
Because it eliminates the possibility of pulling.
Okay.
Okay, yes, sir. Yes, ma'am, sorry.
I know he likes to undo his leg thing.
So that's something, so you guys should be monitoring that all the time.
Okay.
So when he's on your shift, whatever shift you're working, you got to, again, you guys are working for Peter, working in Michelle home. That is everybody's responsibility, not just one person's responsibility. If you scan in the room, you see something's not right, you're thinking, okay, now the person died, oh, you got the leg bag, you got the insulin, you got diabetes. That person should have the devices and things are in place. You should develop a set of eyes for your patients. And that's, if they didn't need to be here, then they don't need your help. So you can't say, well, Talisha got that one, Grandma Susie got that one. No, we're all your patients. You should be all looking in the room, looking in your facility. They're all your patients. You got a check last week. You're going to get that check, you're going to spend it, and you should be everybody paying attention to your patients. Okay? So, again, like, you put the bag inside, put it where, just drop stuff all over the place, and strap it down, and it should be secure. Again, if you got the leg bag situation going on, it should be covered because if the state surveyors come in, they're gonna say,
What is that?
you wouldn't let anyone urinate in the corner. So for dignity's sake,
Right.
and keeping the person's personal, making sure that they are clean or whatever, that's their respect. Residents' right. Any other questions? Okay. Now, if there's a problem, if he's running a temp, he's complaining of pain in his belly, should you ignore it?
No.
What should you do?
Take the temperature and call someone.
Okay, now, in this case, you probably alert Shar. If Tony's here or whatever manager's here or whatever nurse you can get hold to take care of that. Or in this case, maybe, I'm not sure, it depends on.
Sure, they need to let the house manager know immediately.
Okay,
That's who they call.
all right. Again, if there's pus, blood, urine looking a little cloudy, has an odor, you should report it to who?
Sure.
Okay. All right. Now, as the gentleman, since he's been here, has he had a problem with his catheter at all?
No.
He's got a UTI.
And you should make sure he's well hydrated.
Yeah,
That's
when
another thing.
he just moved in 2 weeks ago?
Friday.
Or a week ago today.
Okay.
No, it's been 2 weeks.
It's been 2 weeks, and he had a UTI, he was being treated for a UTI.
Did he finish with his antibiotic treatment?
Today is the last.
Today, right.
Today's the last day?
At 8 o'clock tonight will be his last
Okay.
day.
And those are things that you really should be, at my facility, when I have a person on antibiotics, you take the temperatures every single shift. Because while you're on antibiotic therapy, sometimes things just don't go right. Sometimes the medication may not be strong enough, which is not your job to figure that out. But you take it and tracking vitals, certain things on that patient. So definitely taking temps. So if the temps are going up and down, you think to yourself, tell Shar. Shar know who to contact, nurses, care managers, whomever, so that they can report that to the doctor. Okay? Any other questions?
So how often is that empty? Is it every?
You know what? As many times as you're doing your rounds, I would empty. Or when you notice the bag is a half full to 3/4 full, no higher than that. You should never get to the point when you look at it, it's going to explode. So if you're doing your rounds, you should be checking this bag.
So how often is the bag supposed to be changed out?
This bag should be done, well, if you change it from night to night
No, I'm saying like,
you mean this bag here?
like the bag period, like if how often should the bag be changed? Like every, like.
Which bag, you talking about the leg bag or this bag?
Both bags.
Well, for one, if you see any tears, any leaks, that should be changed. This will be changed and maintenance the tubing itself will be done every month or as needed.
And that's what the nurse comes out and does.
Right. And just letting someone know. And then you should have plenty of supplies.
You do.
And if a home care agent is coming in, they'll bring their supplies. So if you see anything going on, please don't think about, oh man, I thought about that a week ago. Just tell somebody. It's not going to change the situation, but it will worsen the situation. You're just holding information. Okay. Any other questions? How am I doing with time?
It's 10:30.